U.S. Healthcare System by Michelle White. Today's healthcare is not only complex, it is significantly different from what it used to be. Some key points to remember about the U.S. healthcare is how it provides quality services while minimizing costs. Also, how it measures quality service while ensuring healthcare is easily accessible to everyone. A recent healthcare reform policy includes the Affordable Care Act, also referred to as Obamacare, and this includes the patient protection. Healthcare functions as an industry. It functions much like a business using the MCO approach. MCO stands for Managed Care Organization. Managed care has an administrative structure that serves as the intermediary between a healthcare provider and the consumer, which is the patient. The administrative structure regulates the expenditure of resources of the healthcare provider. Before the 20th century, most relied on folk remedies to treat their patients. Training standards emerged by the mid-1800s, and the Civil War brought forth changes in the way medicine was practiced and procedures were done. From the 1900s to 1950s, public health advanced with the objective to protect all Americans and their communities from preventable serious health threats, especially communicable diseases. Many were left with no means to pay for medical services, so this era also brought forth health insurance to make medical services more affordable and accessible. In 1965, President Lyndon B. Johnson announced his program to create Medicare and to launch his war on poverty with Medicaid. These new programs had the goal of improving health care for the poor and aged because at this point they had limited access to quality care. With the next era, which was from 1980 to the present day, came the arrival of corporate care. Even standalone hospitals were disappearing as large corporate networks came to define medicine. The government redirects its policies toward privatizing publicly funded institutions, and hospital systems were integrated into larger healthcare networks, which included ancillary healthcare-related businesses. Marketing practices, including direct-to-customer advertising for pharmaceuticals and medical devices, increased significantly. Healthcare providers play numerous roles in the overall well-being of their patients. In addition to providing assistance with physical needs, healthcare providers offer advice and direction for illness prevention and injury. The patient is the one seeking the assistance for their illness, and the employer assists the patient by providing affordable insurance by paying a portion of the premium. Funding of the U.S. healthcare. Private health insurance is most often offered by employees or their employers or other organizations. Government or public insurance is state-run, such as Medicare and Medicaid. In order to receive these types of funding, there are certain criteria that have to be met. In reference to employer and employee cost sharing refers to how health plan costs are shared between the employer and the employee. Medical technology. An example of medical technology would be the electronic health records. The electronic health records enables the healthcare provider to share one secure chart, facilitate patient care, and eliminate or reduce wasted patient and travel time. It allows all providers involved to be on the same page when it comes to the patient's care. United States versus Canada's healthcare. A lot of people have the common misconception that other countries have figured out all the right answers to healthcare. Canada believes that all their citizens are entitled to medical care. Basically, if it is medically necessary, they will get it. It has a national health insurance program. It is a government-run health insurance system that covers the entire population. The health insurance is universal. The healthcare system is called Medicare. Basically, it has a well-defined medical benefit package. And the system of healthcare is known as Medicare, and it is not the same as the Medicare plan that we have here in the U.S. How is the healthcare paid for? Their healthcare system is publicly financed. The physicians receive payments on a negotiated fee-for-service rate. Hospitals receive global budget payments. Per the 1984 Canada Health Act, health insurance is available to all residents, no out-of-pocket charges, first dollar coverage of all medically necessary services. Quality of health care. Some of the major concerns include long wait times, difficulty in accessing care. With everyone having access to health care, long wait times can be expected, and finding a primary care doctor that is not already at their limit for clients can be difficult also. Some pros and cons. Some pros of the Canada's healthcare is universality, care for everyone. Another one is veterans are well taken care of in their later years. Cons, longer wait times. Costs could be too high for some and not for others. Revenue may not get distributed evenly. Okay, everybody is insured, and being universal offers better quality assurance. Conversely, the wait times can be longer. The fact that veterans in care homes or senior centers are well taken care of in their later years is a plus. Smaller cities may receive less funding, and there may be a shortage of facilities or specialists, which means that patients will have to travel further for medical assistance. Compared to the U.S. healthcare, similarities include most expensive item on both budgets. Both have limited programs that provide prescription drugs. Some differences include the U.S. is insurance is not universal. Canada has less doctors per capita. Future reforms of the U.S. healthcare. Healthcare plans need more incentives to encourage the consumer to spend wisely and effectively. But consumers need to be educated on the healthcare system and how it works. Medicare and Medicaid needs to be expanded. U.S. healthcare in 10 years. With continuous improvement, the U.S. healthcare system can and will evolve. Consumers will be more educated on how the system works and will get more involved with their treatment and what works for them. The U.S. government will become more involved in the funding behind reimbursement due to the fact that most Americans will still not be able to afford health care, even though it is supposed to be provided to everyone at an affordable price. Economics, however, will not allow the average American to the allowance because of the high cost of living. Thank you.